Hey, Assalamualaikum and good morning to one and all. Today we'll study about part 3 of anticonvulsant drug. So before going ahead, let's see what we have studied in part 2. So part 2 of this chapter, we have studied about mechanism of action of anticonvulsant drug, its classification, pharmacology of phenytoin and salient features of ethosuximide. I am Professor Sheikh Abu Sufyan. Welcome you to AS Academy Learning Forever. At the end of this e-learning session, you are able to explain pharmacology of carbamazepine and valproate, give salient features of secondary and new anti-epileptic drugs, discuss clinical uses of anti-epileptic drugs. Let's start with first drug, that is carbamazepine. So remember that the carbamazepine, it is chemically derived from tricyclic antidepressant drug. So TCA or tricyclic antidepressant, basically these are the drugs which are used in the treatment of depression. TCA, it consists of 3 rings, and when TCA it is substituted with the different groups, it leads to invention of the carbamazepine. So although carbamazepine it is not a purely antidepressant drug, but it was observed that carbamazepine it having very good anticonvulsant activity. Let's see the mechanism of action of carbamazepine. Carbamazepine, it blocks sodium channel. Since it blocks sodium channel, we know that the sodium it is responsible for generation of action potential. Since it blocks sodium channel, there is no generation of action potential. So no generation of action potential. As a result of that, it reduces excitement of the CNS. And we know that the convulsion it is result of excitement of the CNS. Since it blocks sodium channel, reduce generation of the action potential, it reduces the excitement of the CNS and control the seizure, which is seen in case of the epilepsy. It is most widely used anti-epileptic drug. The reason behind this, it having less toxicity as compared to phenytoin. Since it having less toxicity, it is most widely used anti-epileptic drug. Carbamazepine, it is effective in treating complex partial seizure. So complex partial seizure, basically it is one of the type of localized seizure. So we have seen there are 2 type of seizure. One is partial seizure, which is localized in nature, and another seizure it is generalized in nature, where there is excitement of the CNS, it is seen in entire brain. Okay, so it is effective in treating the complex partial seizure. It is also used for the treatment of various type of neuropathic pain, including trigeminal neuralgia. So trigeminal neuralgia, it is the pain which is happen generally in the face, because the trigeminal nerve, these are the nerve which connect your facial muscles with the brain. The patient where there is more sensitization of trigeminal nerve is there, you can see those patients suffer from very severe pain at the face. So suppose if the female, if they are having the excessive excitement of this trigeminal nerve, then they may suffer from pain when they apply the makeup. Okay, so whenever they use the makeup, they may suffer from this type of pain. Secondly, it can be also used for the treatment of manic depressive illness. So the mania, it is one kind of the depression where patient it is excessively aggressive, right? So generally in case of the depression, patient remains isolated and he is depressed, but it is the just exactly reverse of the depression, where the patient behavior become aggressive in nature and he suddenly become aggressive. It is called as the mania. Since it having their origin from as a tricyclic antidepressant drug, it can be also used for in case of manic depressive illness. Let's see about pharmacokinetic aspects of the carbamazepine. Carbamazepine, it is well absorbed orally, and since it is well absorbed orally, it is given in the form of the oral formulation like the tablet. So it is given into the oral formulation. Another important part about its pharmacokinetic is its plasma half-life. It is very long. It is about 30 hours. Okay. So since it having long plasma half-life, this drug can be sufficient as a once a day dose. Although plasma half-life of the carbamazepine it is 30 hours, but after repeated use of the carbamazepine, since carbamazepine it is strong enzyme inducing agent, it increases rate of its own metabolism. Since it increases the rate of its own metabolism, plasma half-life, it is shortened to about 15 hours, right? So although it having the plasma half-life of the 30 hours, but since it is strong enzyme inducing agent, its plasma half-life, it is reduced from 30 hours to 50 hours when it is given repeatedly. So when you continue the treatment with the carbamazepine, generally maybe for a 1 month or the 2 months, so after repeated administration, its plasma half-life, it slowly or it is gradually decreased to 15 hours. Since it is gradually decreased to 15 hours, you may need to increase the frequency of its dosing. Maybe initially you have started with once a dose tablet. Maybe when you give it repeatedly, you need to increase the dosing frequency like the twice a day, or sometimes when it is not effective due to its strong enzyme induction, you can switch over that patient to another drug. Okay, so this is how the pharmacokinetics play a very important role in the treatment with the carbamazepine. So you need to decide the treatment of the carbamazepine based on its pharmacokinetic property. Let's see what are the unwanted effects. So carbamazepine produces the dizziness, that is the feeling of the giddy, and sometimes feeling that you may experience during the vertigo. Okay, so the patient suffer from the dizziness, he suffer from the ataxia, that is total loss of the body control. Maybe you want to walk but you are unable to walk, you want to move your hand but you are unable to move your hand, right? So what is this? This is called as ataxia. So this is one of the common symptoms in case of carbamazepine. Patients suffer from dizziness and the ataxia. In addition, patients also show more severe mental and motor disturbance, where the patient behavior it is changed little bit and its motor control it is reduced. In addition, the carbamazepine it produces water retention and variety of GIT and cardiovascular effect. Okay, so since it having this problem, so those patients who are having coexisting GIT disorder or coexisting cardiovascular diseases, in such cases it is better to avoid carbamazepine. It also produces the dose related toxicity. So as you increase the dose, its toxicity is increased. So to avoid dose related toxicity of the carbamazepine, what you can do, you can start treatment with low dose. So treatment it is usually start with a low dose and then you can gradually titrate it. Maybe you can continue increasing the dose of the carbamazepine till the patient start responding to it, or where the patient showing minimum unwanted effect. So to avoid dose related toxicity, the treatment is usually started with the low dose of the carbamazepine. So this is all about carbamazepine. So to summarize, the carbamazepine it is derived from tricyclic antidepressant drug. It blocks the sodium channel, reduce the excitement of the CNS and control the seizure. Okay, it is widely used because it having less side effect as compared to the phenytoin, right? As far as this pharmacokinetics concerned, the carbamazepine it is given through the oral route, so it is available as an oral formulation. Second important point, it is very strong inducing agent. Since it is very strong inducing agent, although it having the original plasma half-life of the 30 hours, but when you use carbamazepine repeatedly, the half-life of carbamazepine it is reduced to 15 hours because it produces its own metabolism due to enzyme induction. Then we have studied about adverse effects. So it produces the adverse effect like the dizziness, it produces the ataxia, then it produces very severe mental and motor disturbance, right? So if you want to avoid their dose related toxicity, what you need to do is you need to titrate the dose of carbamazepine. Maybe you can start the treatment with a low dose and then you can gradually increase the dose of carbamazepine. So this is all about the carbamazepine. Let's see about the next drug, that is Valproate. So the Valproate, it is chemically it is simple monocarboxylic acid. So what this mono indicates? So mono it means it having the single carboxylic group in its structure. So you call it as a simple monocarboxylic acid. Let's see when we use Valproate. So Valproate it is useful in certain type of infantile epilepsy. So infantile epilepsy, it is the epilepsy that is happened to infant. So infants means these are the newborn baby. So when newborn baby, they are suffering from the epilepsy, such type of epilepsy are called as infantile epilepsy. So what is important in case of infantile epilepsy? So most important point is, or the newborn baby, their organ it is developing and they are very delicate in nature. So whatever drug you are using, you must ensure that it having low toxicity. So we have seen in case of phenytoin, in case of carbamazepine, both the drug they produces good amount of toxicity. So this drug cannot be used in case of infantile epilepsy. So you can use the Valproate because it having the low toxicity and also it lacks sedative action. We know that especially the newborn baby used to sleep for the 10 hours, sometimes 12 hours, or most of the time the newborn baby they are sleeping, isn't it? So if you are giving if you are giving the drug which produces the sedation, like we have seen in case of carbamazepine and phenytoin, both the drug they produces the dizziness as well as drowsiness, right? So if you give this drug, they produces more sedation. So Valproate having the advantage, it having low toxicity and also it produces less sedative action. Due to both these good property of the Valproate it is one of the good drug that can be used for the treatment of infantile epilepsy. It is also used in case of the adolescents or the adult patient when there is a condition where grand mal and petit mal epilepsy is coexist. So it is very rare condition. Generally that is grand mal epilepsy, that is tonic-clonic convulsion, and petit mal epilepsy, that is absence seizure. It is rarely coexist. But if it is coexist, then Valproate can be one of the good drug for the treatment of such situation. Or it is used as a mood stabilizing agent, so very important use. So the mood stabilizer, these are needed especially in case of bipolar depressive illness. So the bipolar depressive illness, it is the disease where patient mood it is swing from the depression to mania. Okay, so the patient become depressive and then suddenly he become manic. So manic, it means suddenly he become aggressive in nature. So when the patient mood it is swing from depression to mania or from mania to depression, in such case to stabilize their mood you need mood stabilizing agent. So Valproate it serves as very good for stabilizing the mood of those patients. Let's see the mechanism of action, how it's work. So Valproate it works by increasing the content of the GABA. We know that the GABA it is inhibitory neurotransmitter. Okay, so the GABA it is inhibitory in nature. Since it increases the GABA content, it produces inhibition of the central nervous system. So since it produces inhibition of the central nervous system, it can effectively reduce excitement of the brain. Okay, so it can reduce the excitement and it reduces the convulsion. So convulsion can be controlled because it is inhibitory in nature and it reduces the excitement of the central nervous system. So let's see how it increase the GABA content. So it is not directly acting on the GABA receptor, but it is the weak inhibitor of two enzyme system that basically inactivate the GABA. So there are two enzymes which inactivate the GABA. One, it is the GABA transaminase, which convert GABA into its metabolite. So it inhibits this GABA transaminase enzyme. Also it inhibits another enzyme which convert GABA into its metabolite, that is succinic semi-aldehyde dehydrogenase. Since it is weak inhibitor of these two enzyme system, it does not convert GABA into its metabolite. As a result of that, there is increase in level of the GABA, which produces inhibition of central nervous system, reduces the excitement and control the seizures which are associated with the convulsion. So this is how Valproate they act as an anticonvulsant drug. Let's see about the pharmacokinetics of the Valproate. So Valproate it is well absorbed orally. So it is given in the form of the oral dose. So it is available as its tablet formulation. It is excreted into a urine as a glucuronide. Okay, because the Valproate it is metabolite into the glucuronide metabolite, which is water soluble in nature. Since it is water soluble, it is easily excreted in the urine as a glucuronide metabolite. Let's see about the plasma half-life. So the plasma half-life of the Valproate it is 15 hours. Since it having the 15 hours of the plasma half-life, Valproate you need twice a day. So the dose frequency of the Valproate, it is twice a day because it having plasma half-life of the 15 hours. Okay, so this is all about the pharmacokinetics of the Valproate. Let's see about the unwanted effect. So Valproate, as we already seen, it is generally free of unwanted effect, but although we say it is free of unwanted effect, but still it having some minor unwanted effect. So let's see what are those effects. It show the thinning and curling of the hair in 10% of the patient. It means it is not seen in all kind of patient, it is only seen in case of the 10% of patient. So those patients who are produces the symptom related to Valproate. So if you identify those patients, then those patients you cannot give the treatment with the Valproate, okay, because it is rare unwanted effect that is seen only in case of 10% of patient. Okay, another problem, that is rather the more serious side effect of the Valproate, you can say it is the hepatotoxicity. So Valproate produces the toxicity of your liver, which is very serious in nature, because liver, it is one of the vital organ. So this is the most serious side effect of the Valproate. And lastly, Valproate produces the teratogenic effect. So what do you mean by teratogenic effect? Suppose the drug, if it is given to the pregnant woman, then that drug, if it produces the effect on the baby which is born to that pregnant woman, then that effect, it is called as the teratogenic effect. Okay, so if you know that the drug, it is teratogenic in nature, then such drug should be prevented in case of pregnant women. So that precaution you need to take. So let's see what effect it produces in case of pregnant women. So if suppose mother is taking the drug, then the newborn baby delivered by that particular mother, that baby may suffer from spinal bifida. Okay, so what is spina bifida? It is the condition where there is protrusion of the spinal cord outside the body. So this is how exactly it is happen in case of spina bifida. So the spinal cord, it is protrude from the spinal cord, it's come outside, and this is how it's look when you see the backside of the baby. So what that indicate, the patient is suffering from the spina bifida and neural tube defect. Why it is called as neural tube defect? Because the spinal cord, it's come out of its original neural tube. What is the original neural tube of spinal cord? The original neural tube of the spinal cord, it is the vertebra. It should remains in a vertebrates. But since it's coming out of the vertebrates and it is protruded out, right? So this effect, it is called as spina bifida. So one precaution that you need to follow, that this drug should not be given to the pregnant woman. So this is all about the Valproate. So to summarize, we have studied that the Valproate, it is the GABA enhancer. It is used in case of the infantile epilepsy because it having low toxicity and does not produces the sedative effect. We have seen pharmacokinetics given the orally, right? And secondly, it is excreted as a glucuronide metabolite, so it is converted into glucuronide, so it is excreted as the glucuronide metabolite. And third important point that we have studied about pharmacokinetics of Valproate, it is the T-half, it is the 15 hours. Since it having less T-half, so the frequency of dosing of Valproate, it is twice a day. In addition, we have also seen about the mechanism of action. So Valproate, it basically increases the GABA level by inhibiting the two enzyme GABA transaminase, and second one, it is succinic semi-aldehyde dehydrogenase. Let's see what are the other drugs which are used in treatment of the convulsion. So other drugs which are used in the treatment of convulsions, they are called as the secondary drug. It means they are not used as a primary drug in the treatment of the convulsion. It can be used when primary drugs are not effective or it's showing more side effect and the patient is not able to tolerate the primary drug. So the drug which we can use as a secondary drug are phenobarbital. So phenobarbital, it's belong to the category of barbiturate. And what is the problem with the barbiturate? Barbiturate, they produces very high sedative action because the category of the barbiturate, it is hypnotics. They are sedative and hypnotics in nature, right? So as a result of that, they produces very high sedative action and the patient, their day-to-day activity may be affected. So since it produces very high sedative action, generally barbiturate are not a preferred drug as an anticonvulsant drug. In addition to barbiturate, you can also use the benzodiazepine. So benzodiazepine, again, this drug we already seen in case of sedative and hypnotics chapter. These are the drug which produces the sedation Basically, benzodiazepine, these are the drugs which act on GABA benzodiazepine receptor and increases the chlorine channel opening. And due to opening of the chlorine channel, it produces hyperpolarization and inhibition of the central nervous system. And we know that all those drugs which inhibit central nervous system, they produces the anticonvulsant action. So we are not going into the detail of this drug because we already studied this drug in the sedative hypnotics and anti-anxiety chapter. So I am not repeating detailed pharmacology of these drugs. But point to remember is that when to use these drugs. So these drugs are used specially in the treatment of status epilepticus. So status epilepticus, it is the epilepsy where the seizures are continue for more than 5 minutes. So generally the epilepsy, it start and may over within 1 or 2 minutes. But if seizures are continue for 5 minutes or maybe 2 to 3 seizures are coming within the periods of 5 minutes, this situation it is called as status epilepticus. So in such case, you cannot use the drug like phenytoin and carbamazepine, but you need to use the drug which produces very high rate of CNS inhibition. So you can use the phenobarbital or you can use the benzodiazepine. So if question it is asked in exam, write about pharmacotherapy of status epilepticus, then you must first write the classification of the barbiturate. Then you will be writing about the classification of the benzodiazepine and then discuss any one drug in a detail, like you can discuss the diazepam or you can discuss the barbiturate pharmacology. Okay, so this is how you can write the question which is related to status epilepticus. In addition to this, there are many new anti-epileptic drugs are available in the market. So let's see what are those drugs. So one of the drug, it is vigabatrin. So mechanism of action of the vigabatrin is it inhibit GABA transaminase enzyme. So we already seen in case of valproate. Valproate is also weak inhibitor of the GABA transaminase. So the GABA transaminase, it is the enzyme which produces the metabolism of the GABA. Okay, since it inhibits this enzyme, what happened due to that? There is increase in level of the GABA, and GABA we know that it is the inhibitory in nature, and due to its inhibitory nature, it reduces the excitation of central nervous system, and it can be able to control the seizures which are result of excessive excitement of the CNS. In addition, it is effective in a patient who is unresponsive to the conventional drug. So what are the conventional anticonvulsant drug? So conventional anticonvulsant drug are the phenytoin, and second it is carbamazepine. So if patient is not responding to the conventional anticonvulsant drug, then you can use the new anti-epileptic drug like the vigabatrin. So it can be tried. The main side effects are including the drowsiness, and it produces the behavioral and the mood change. So these are the side effects of the vigabatrin. So although these side effects are there, but these side effects are less as compared to the side effect of the phenytoin, carbamazepine and valproate. So even vigabatrin can be thought of one of the good drug for the treatment of the convulsion. In addition to this, the lamotrigine is also one of the new drugs. So mechanism action, it is sodium channel blocker. So we have seen one of the drug belong to this category was the phenytoin. So it inhibits sodium channel. It having broad therapeutic profile, so it can be used for the treatment of different type of epilepsy since it having broad therapeutic profile. Whereas in case of, we have seen in case of the carbamazepine, it is used in case of partial complex seizure, whereas the phenytoin, it is used in case of tonic-clonic seizure and also in case of all type of partial complex seizure, right? Ethosuximide, it is used in the treatment of the absence seizure, but the lamotrigine, it is the drug, although it having the mechanism action which is similar to phenytoin, that it inhibits sodium channel, but it having very good broad therapeutic profile. Although it having broad therapeutic profile, but lamotrigine, it produces the hypersensitivity reaction. So it produces the skin rashes in the patient who is sensitive to the lamotrigine. So if there is history of the patient who having the hypersensitivity reaction to the lamotrigine, then you should not give this medicine to that particular patient. So this is all about different type of anti-epileptic drug. So in this chapter, we have studied three important category of the drug: the sodium channel blocker. So we have seen the phenytoin, carbamazepine. We have seen the GABA enhancer like valproate, benzodiazepine and barbiturate. And third category that we have studied was the calcium channel blocker, that was ethosuximide, which is used for the treatment of the absence seizure. Let's see what are the clinical uses of the anti-epileptic drug. So the first clinical use, obviously it is related to their anti-epileptic action. So it is used for the treatment of different type of epilepsy. For example, in case of tonic-clonic or grand mal epilepsy, you are using the drug like sodium channel blocker, you are using carbamazepine, you are using phenytoin, and you are using the GABA enhancer like the Valproate. Okay, whereas in case of partial or it is also called as the focal seizure, that is localized in nature, you can use in addition to carbamazepine, Valproate and phenytoin, you can also use the benzodiazepine. So you can use the clonazepam, which is the drug belong to the category of the benzodiazepine. The third use for the treatment of absence seizure. For the treatment of absence seizure, so you are using the calcium channel blocker and you are using the Valproate, which is the GABA enhancer. Okay, so these are the drugs which are used for the treatment of the absence seizure. So absence seizure, it is only the seizure which is not controlled by the phenytoin, whereas if you see the phenytoin, it is able to control even tonic-clonic seizure and all type of partial seizure, but only the absence seizure, it is something which is not controlled by the phenytoin. So you need to use the calcium channel blocker like ethosuximide or GABA enhancer like Valproate. Okay, so these are the different drugs which are used in the treatment of different type of epilepsy. Let's see what are the other use of anti-epileptic drugs. So in addition to its use in the treatment of different type of epilepsy, what are its use for the treatment of other diseases? So we can use anti-epileptic drug like carbamazepine and gabapentin, especially in case of neuropathic pain. So we have seen in case of carbamazepine, it is used in case of trigeminal neuralgia. Okay, so trigeminal neuralgia, it can be easily treated by using the carbamazepine. So we are using carbamazepine for different type of neuropathic pain. We can also use it for the treatment of stabilizing the mood. So it is needed in case of bipolar disorder, where mood it is swing from depression to the mania and from mania to depression. So to stabilize the mood of such patient, you can use anticonvulsant drug like carbamazepine and Valproate. But remember that the primary drug for the treatment of the mood swing or the bipolar disorder, it is the lithium. But if the patient show very severe side effect to the lithium, then in such cases, as an alternative to lithium, you can use carbamazepine and Valproate as a mood stabilizing agent. Okay, so this is all about anticonvulsant drug and their uses. So these are the reference book that I have referred to gather the content of my slide deck. So you refer to this book for your detailed study. In addition, for the quick assessment of your learning, I recommend you to go through this fun quiz. So you will really enjoy this fun quiz that I have made by using the quizzes site. Thank you all for watching my video. For more such learning, subscribe to my channel. And if you like my video, then don't forget to click thumbs up. Thank you.